after this introductory session, I hand over this session to respected Vasant Patil sir. Dr. Vasant Patil sir. Hello. Hello.
Yes, thanks, doctor, for the introduction.
Thank you, sir. Thank you, sir.
Madam, Reena, madam.
Am I audible, sir?
Yes, ma'am. Yes, ma'am. You are audible.
Yes, proceed, madam.
Yes. Thank you, sir. Good evening, everyone. Respected teachers, students, and my dear friends. First of all, I would like to thank Dr. Vasant Patil, sir, and All India Panchakarma Teachers and Specialists Association for giving me this wonderful opportunity. That too on the day of the Children's Day. Now, it means a lot for us. Children's Day means a lot for us. And I mean, it's been a wonderful opportunity. And regarding this, I also thank the Dr. Samir, Dr. Dodabasaya, and all the team members for giving me the warm welcome and for those kind words. I would say that I'm still a student and greatly inspired by Dr. Vasant Patil sir and many other stalwarts of Panchakarma in India, especially. And I would like to remember my PG guide, my UG teachers, and especially the institute where I began my career, STM Hassan, where their guidance and the opportunity has given sort of experiences which we are trying every day when we come across various conditions in children. And I would like to share few of these experiences. And I would also like to say that these may not be the final words. These are a part of experiences. And we have to have a lot more explorations in Kamarvritya, because we know that there are only few practitioners who do practice Panchakarma in Kamarvritya, as well as how sensitive it is to practice Panchakarma procedures in children. This also we all know. Considering these factors, these are some of the observations which we have done so far, and there may be many more to come in the future. Open discussion on this aspect, and of course we have a lot of Panchakarma experts as such in this platform. So if they can contribute their experiences along with this, I think that would serve the purpose of today's organizing this particular lecture. And once again, I would like to thank everyone who are involved in this activity, and would like to begin with the session. Thank you.
Madam, thanks a lot for your introductory remarks and as well as your opinion regarding today's session, and as well as your brief experiences. Shall we start the questions, madam?
Yes, sir.
Yeah, the first question: the role of Panchakarma for the prevention of communicable and non-communicable diseases. Madam, please try to explore your experiences regarding especially the communicable disease, as we are going to discuss non-communicable later in this session.
Yes. This is a very important question because we are running through the era of pandemic now, and we all know the impact of COVID-19 in and around, and along with the many families whom we know. Now, in this regard, this becomes very important. It may not be only COVID-19. There could be many other communicable diseases. Simple from a flu to tuberculosis, leprosy. There are many other conditions which can be communicated from one person to another. Now, when we speak of comorbidity, the major thing which the child either can transmit or can get transmitted with the disease is mainly through the family. So it becomes very important to maintain the health of the family. Now, most of these conditions sometimes can prop up as a part of seasonal changes. We know that there are seasons, they are prone for viral infections. Say, for example, Pravrut, we speak of just before the rainy season, or now the season just it is at the verge of ending now, just at the start of the Sharat. Okay, these are the seasons where the viral infections are many. So these are the conditions that can be easily transmitted. Now, how to prevent these conditions, right? Now, prevention through Panchakarma, rather I would say through some of the procedures which could be either adopted in the form of Dinacharya and Rutucharya, which are as a part of Panchakarma. They aid in prevention of these communicable diseases. Say, for example, in Kashyapa Samhita, it is mentioned Abhyangam, Udvartanam, Snanam cha Pratyaham cha Samacharet. For a child, you have to do certain procedures every day, say including Abhyanga, Udvartana, then Snana, and there are other procedures like Karnapurana. Then he has also mentioned like Katutaila Pratimarshanasya could be done to a child. So what happens when we keep these orifices clean, as well as the skin integrity intact? So they also aid in improvement of the Agni in the child, and at the same time they would maintain the health of the child. Thus, the child may not be easily exposed to or getting contracted with these infections. Moreover, we have Rutucharya also mentioned. They say that Rutu Sandhis are there, and during these Rutu Sandhis, there are a lot of variations with the Agni. And the maintenance of Agni itself is a very good thing to prevent propping up of the diseases. So, Rutu Sandhi Charya, again, use of simple remedies. Say, for example, use of the Adraka, then Jiraka, kind of the spices in the food during this period. It's going to prevent and it's going to maintain the Agni, and it's going to maintain the health of the child. Similarly, this is for normal children. In fact, those children who are prone for certain diseases. So, for example, nowadays in our hospital, we have children coming with a lot of Tamakashwasa manifestations. We do have children coming with allergic manifestation in this season. Now, what happens? The Sharat is a period where you can give just a Sadhya Virechana, or those children who are really suffering, we can start give Shodhana, Virechana would be a very handful measure to prevent propping up of these diseases, and that going to complicate the child. Similarly, Sadhya Vamana just before the start of Vasanta Ritu, right, or during the Vasanta Ritu, is going to prevent a lot of respiratory illnesses in children. And we all very well know that respiratory is the major chunk of diseases which affect the children. So, and moreover, one more thing, like children, especially those in Kshiranadavastha and those children in the school-going age, they have unknowingly have the habit of controlling Vegas, right, especially Mutrarodha as well as Mala Avarodha. So these things are very common in these children. So it is better. So when we know that it is to educate the parents, or whenever these children visit us, to start with some Pachana and Anulomana Aoushadhas so that we can prevent the diseases. Hope sir,
Okay,
I have
madam.
answered.
Yes, madam. Regarding the Katuthalness, your observations, use
So
of
it is,
Katuthalness in pediatrics, madam.
yeah, yes, sir. It is a very useful one. Like, it is non-irritant. We normally say that Sarshapathaila may be irritant one, or it is Ushna and all. But Katuthaila with a pinch of salt. So now we actually had prepared like Anuthaila drops when we were studying. We just did it like a experimental study, and children used to respond very well, and it used to prevent conditions like recurrent nose block and recurrent runny nose in children. And the child used, the major complaint with the parents used to come is that noisy breathing, and child is getting up in the night, not sleeping well. So these complaints were relieved very well. And our observation was that, like, if we put Nazivion drops or saline drops, like for about 1.5 to 2 hours, child would be comfortable. But if we use either this Katuthaila or even coconut oil for that matter, 3 to 4 hours, child used to be very comfortable. So this was the observation.
Okay, madam. In North India, neonate, the newly born child, they will put this Katutailam, Sarshapathaila, for cleansing all the mucus, etc.
Correct, sir.
My friends, patients, Rajasthani and all these North Indians, they regularly use this, even in neonate also.
Correct, sir. Especially in neonates, we want something Ushna Taila to maintain the temperature. So Katuthaila would be a very good option.
Okay. Next,
Thank
we'll
you.
move to second question.
Yeah.
How Shodhana should be performed in Balyavastha, especially considering the drug dose and all other precautions?
Yes. Well, this is a actually $1 million question. How to practice Shodhana in children? Classically, Shodhana is indicated.
In general, madam, yes, in general, later Vamana is there particularly. That's why. In general, it is.
Yes, sir. Yes, sir. Sure. Classically, we know that there are conditions, especially in Kaphajas Sanidushti, Kukunaka, Visarpa, Mahapadma Roga, Ahiputana, Talukantaka, Parigarbhika, then Pakkaroga. The use of Panchakarma is very well highlighted in Kamarbhutya. Now, in general, to speak, Bahudoshavastha, and we should not forget the Chikitsa Sutra of Kamarbhutya that says that Eva dosha dushya jwaradya vadayastu yat atas tadaiva bhaishajam matratu asya kanyesi. Whatever the diseases which are seen in adults definitely are seen in children also. And these diseases are having the same dosha, dushya, and pathogenesis more or less. So, more or less, even the treatment principles are also very similar. So, we have to identify that Bahudosha Avastha in a child, and accordingly, we may have to adapt the Shodhana procedures. Say, for example, if we want to induce Shodhana for a Kshirapavastha, it is very rare that we see Kshirapavastha child may be requiring Shodhana. How do we identify such conditions? We know that the child in infancy coming with recurrent cold cough, nose block, or recurrent diarrheal episodes, or the child is always cranky, coming with a distended abdomen, or infancy, the child coming with some of the skin manifestations. So these all may be considered that this could be because of the Stanidrushti. And in such conditions, we may plan the Atri Shodhana. And along with the Atri Shodhana, if it is Amavastha or if it is Kapha Pradhana Avastha, then we may even plan very mild Shodhana for a child. And the way how to administer the medications for this, as we know that if the mother is given medication and their part of this medication may be transmitted through the breast milk. At the same time, we can use some of, say, for example, you want to induce a little bit of Vamana, a pinch or 2 pinch of Madana Phala Churna, because classically Madana Pushpa is mentioned. If Pushpa is available, Pushpa Churna, that are a very little quantity of Madana Phala Churna itself can be made as a paste, applied over the nipple, and we can ask the mother to feed the child, or similar paste can be applied over the lips of the baby, and the baby may be fed. Maybe after a few minutes, the baby would regurgitate the little amount of the milk, and as soon as the baby feeds the milk, that even acts as the stomach full, the akantapana kind of thing, and the child is easily would puke out few of the things that relieves the dosha of the child. And of course, Tikshna Shodhana is indicated to the mother. Similarly, we have classical references in Kashyapa Samhita, where it is mentioned the child presenting with the Admana and Pitta Pradhana features, or sometimes, Kapha Pitta Pradhana features, we can, or disturbances, Pratiloma of Vayu. There is a mention that the child can be given with Eranda Prashana. So Eranda mixed with the breast milk, or mixed with a little bit of honey could be given to the child, that relieves, that act as a little bit of Shodhana for the child. Similarly, we have classical references like a little bit more quantity of this one, Narikela Taila is administered to child to initiate Virechana, because that itself, when it is not absorbed, that itself acts as a triggering factor to improve, have the increased peristalsis, and the gut would be cleared. Similarly, we have the practices like, Suttumaddu or Uramarunnu, where we use Haritaki or Hingu, kind of Anulomana Dravyas, to induce mild Anulomana and Samsana in the child. Similarly, Vacha and ST are present in this Uramarannu, which can just bring about the few bouts of vomitus to relieve. And clinically, we have seen children with a lot of stuffy nose and congestion, even a little bit of administration of Pippali with Mayurapucha Bhasma, the child would just regurgitate and vomit out the phlegm and gets very faster relief. So this is how we can give a little bit of Shodhana in case of Kshiradavastha or in infancy. While it coming to Kshiranadavastha, now we can use some of these procedures again in Kshiranadavastha. But in Kshiranadavastha, GIT problems are more, and of course the respiratory problems. So this could be attributed for the Aniyata Agni, which the child is having because of varied type of food the child is taking, Shira as well as Anna and all. So for these children, Mrudu Shodhana could be given. Probably a Sadhya Shodhana is better for these children because they are already Snigdha, because they are having the Snigdha Ahara. Similarly, in case of little older children, or else, as I said, Kshiranadavastha Aniyata Agni, more of Pachana medicines is good enough rather than going for a Shodhana. And in older children who can present with a Bahudosha Avastha, we can definitely plan a classical Panchakarma in these children.
Okay, madam. Any precautions are okay. Those you have brief, no? I think.
Yes, sir.
What are precautions to be while doing Abhangam and Udvartana and all other Bhaya procedures?
Okay. So, as we know that in pediatrics, rather than Shodhana, the Pradhana Karmas, Purva Karmas play a very important role. In fact, they could be a mainstay of treatment in most of the conditions. Now, if we speak of Abhyanga, I think I would just skip how the procedure of Abhyanga and all is done, because already a lot of seminars and discussions have been done on this. We all know also regarding how to do Abhyanga. But only thing, as we know that children are more prone for hypothermia, we have to have a well ventilated but a warm room when we plan for the Abhyanga or Udvartana in a child. And lukewarm, either it is powder or oil or any kashayas or thylas, if we are using for the procedures, they should be lukewarm. Lukewarm in the sense maybe around 39 degree Celsius, 39 to 38 to 39 degrees Celsius is good enough. And we have to thoroughly check before applying these two onto the child's body. Otherwise, we may cause injury to the child. And before that, taking confidence of child is very important. Otherwise, the moment you take the child to the therapy room, the child would start crying and it becomes very cranky. So, therapist who is handling the Bala Panchakarma should be very playful with the child, and they could be the environment should be like decorated with the toys, and then some sounds which usually the children like, and there could be the provision for a parent to take the child in the therapy room is very essential. And regarding the procedure, maybe the pressure which we use for the adult is too much when we compare for the children. So we need to have a control over the pressure. And regarding there are different strokes and techniques which we use for the adults. More or less, these could be avoided in children. It should be very gentle, and a very straightforward massage for children would be good enough. Otherwise, the regular rules, how to start from the head to toe and what are the direction on different places could be used. In very small children, maybe the positions, 7 or 8 positions which we adopt, that may not be possible. So the major 2 or 3 positions which we will be using and adopting. Sometimes if it is a very infant, table may be again, may not be liked by the child. So there could be provision to do these procedures on the lap of the mother. I think these are some of the things which should be taken care. And the person, who handles the child should have a very gentle and smooth hands. Even with little bit of roughness, the child may get irritated. So that has to be taken care.
Okay. Thanks for elaborating regarding the massage techniques and precautions to be taken.
Yes, sir.
Next question, madam. What are the precautions to be taken during performing different Svedana in Bala?
Yes. Again, Svedana is in fact a Tikshna procedure, as we know. And children, Atyartha Snigdha Rukshoshnam Varjayet. We should always avoid Ati Tikshna, Ati Ruksha, Ati Ushna, Ati Shodhana for children. So now we have to be like, Sarvadharmeshu Madhyamam. It has to be adopted even in Panchakarma when we adopt especially for children. So, as I was telling the classification earlier, Kshirapa, Kshiranadavastha, we can think of using more of Niragni Svedas in infants. See, we know that we do practice Abhyanga for children right from the birth. So, normally, after Abhyanga, we have to give Svedana. In these children, no need to give Svedana. A gentle bath is good enough. Even before that, what we can do is, we can just wrap the child in a firm, warm cloth and keep it. That is just like a Guru Pravarana, just cover the child and keep it. That brings about little bit of Svedana, and immediately we can just give a sponge bath or bath to the child. Similarly, Vyayama. Vyayama can be very well adopted in pediatric population. We know that Vyayama again, not exactly like you have to do yoga techniques or some of the aerobics or something like that for drill. Drill is a nightmare for the children, PT class. So what is the best way to adopt this is playing. Allow the child to play outdoor games, and that makes a good Svedana for children, and that is Again, a very useful thing. We know that nowadays most of the children come with many complaints, and most of them could be just handled by encouraging the outdoor activity. So that is a very useful technique to be used. And fighting with a child at home, right? Brother or the father or mother, just can have a mimic fighting with a child. That itself brings about the Svedana. And this is for a normal children, what I'm speaking about, this Niragni Svedas. And in some of the congenital myopathies, again, we use this technique to bring about after doing gentle massage, or sometimes we use Annalepa kind of Svedana, or Utsadana, or that is warm Utsadana kind of procedure to bring about Svedana. Otherwise, we ask them to just rub the child to bring about the Svedana. Unless in older children, definitely we can adopt all the procedures like Nadi Sveda and Nadi Sveda. When we are doing, we have to be very careful. Like Nadi Sveda, Shashtika, other Pinda Svedas, Ravagaha Svedas, we do use in clinical practice. So when we use this, two things are very important. One is keeping the child in a proper position. See, when we are doing Avagaha and all, the child should be reclining in a 45-degree angle. Otherwise, child may not be having that coordination between respiration and all. And if it gets cranky, started crying, there is a possibility of aspiration. Then regarding the Nadi Sveda, the spillage, the child may be moving. You may not be able to restrain the child. So spillage could be there. So proper care should be taken to avoid the spillage. Next, these Tikshna procedures, the child may go into fainting. To avoid this fainting, classically Kashyapa has mentioned one method, that is Karpura Churnam Asena Dharayet. That means we can allow the child to have a toffee or something like a candy sugar in the mouth, so that the child's attention is also diverted. At the same time, child will be comfortable in all through the procedures. And of course, we have discussed that parents should also be there with the child. And most importantly, when we are using this Bashpa Sveda, Nadi Sveda, Shashtika and all, keeping a talam is very important. Talam could be like, classically mentioned Amaliki talam, or just, cold pack, just a cotton dipped in the normal water, and that could be kept on the child's scalp. That would easily prevent the fainting of the child, and that, playful environment, presence of the parent itself is a lot of, boosting the mental status for the child, and that avoids a lot of complications in the children.
Madam, any serious complications of moderate, severe and moderate degrees have observed regarding the Svedana in pediatrics?
Yes, sir. We had observed, we had a child, we were giving a parishika for a child. Child was very cranky, and it was a little behavioral disorder child. He went into breath holding spell, and he developed a cyanosis on the table of doing Panchakarma. So immediately we had to shift the child to emergency ward, and oxygen supplementation, suction and all is very important. And nowadays what we do is, that's the reason pulse oximeter is readily kept when we are doing such a procedure for a child. And availability of suction facility in the nearby vicinity is very important, sir. So breath holding spell is one of the such grave condition we have come across. And the second one is fainting, right? And third one is by mistake of the therapeutic assistants, like burns and all, is again one of the very important, this one we have come across. And of course, these all could be managed in a clinical setup. But instead of causing the problem and managing, it's being ready to prevent all these things is a prudency, I think.
And regarding the Upanas Sveda?
Yes, sir. Upanaha Sveda, in fact, it's a very, one of the most favorite procedures, and it gives a wonderful results for children. What happens? No, we tie Upanaha Sveda for about 2 to 3 hours in children. Children, especially with the Pitta Prakriti, children with Pitta Prakriti, usually they develop red rashes following the Upanaha Sveda. So, what we normally do is, that's why after Upanaha Sveda, we have made it a mandatory to apply Shatadauta Gruta so that the heat complications would be minimized. And we have also seen that when we use the more quantity of Vacha and Rasna. So these are the two drugs which cause the skin irritations for children. So normally we reduce the quantity of these drugs when we write about the Upanahasveda ingredients.
Madam, which drug you prefer to recommend for pediatricians in case of joint disease?
Joint diseases, usually we use Jatamayadi Churna, sir. And sometimes we do even use Agni Lepa. And sometimes, we may, instead of using Aranala or any Amla Dravyas for making the paste, we use plain water, or sometimes we do even use the milk itself so that Tikshnata is reduced. So that we use. Otherwise, Rasna Churna we apply, and we do avoid the use of Lashuna, use of Palandu, and these kind of drugs which have the Virepradhana Dravyas we normally avoid. And regularly in case of Vata Vyadhis, we go with the Mashagodumadi Uppanaha.
Okay, thank you. Next question, madam. How Vamana should be conducted in pediatric patients and how to counsel the patients and parents as well as?
Yes. Well, when we say that this child needs Vamana, the parents are already worried. They'll ask, what is this Vamana? Why it has to be given? And when we see that the child needs to undergo this is, we conduct a therapeutic emesis, they will be little worried whether the child will be able to cooperate. How do you do this? These are the common questions that even the parents come across. So what we do is, children, preferably Sadhya Vamana is done in Kapha Vyadhis, or when they come with doshas in the Amashya. In those children, we right away do Sadhya Vamana. And sometimes in Ateka Avastha, though it is mentioned in Shwasa, Ateka Chikitsa, sometimes will not be able to do this Ateka Vamana for children. The reason is, already the child is having hypoxia. So what happens when we induce this Vamana, the very procedure itself can increase the hypoxia in the child, and the child will develop the severe chest tightness. So that becomes a little a complicated thing to induce Vamana in young children, especially with acute Shwasa. So what we do is, we give a Shamanoshada for about 3 to 4 days. And once the child's breathing pattern is settled down, we induce Vamana. This is how we practice in case of respiratory, especially in Kafajakasa as well as in Tamkashwasa. Otherwise, in other diseases where Shodhananga Sveda, Vamana, after Snehapana Purvaka Vamana is done, so we will have to counsel the parents. It's a challenge to give both Snehapana as well as Vamana Aoushadhi for children. So we need to explain everything, including even a smallest technique or the procedure which we adopt during the treatment, we need to explain to the parent. So sometimes what happens, when Akantapana is given to child may not accept it from your hand. So what we do is, we call them inside the Vamana room, we make her to be seated with the child, and when she feeds, the child would take. And the palatability is again a very, very important issue with these children. Estifanta, we have seen around, I think we have conducted around more than 100 Vamanas now. So what we see is, child Estifanta, few children they take, they know. They say that you give that juice and that is easy for me to vomit, and they accept it. But there are few children, they never accept tasty Fanta because of its the taste and smell. So what happens? It's a challenge for us again, how to induce the Vegas in between. That becomes a challenge. So what we do is we admit the child a day prior to the Vamana. We thoroughly counsel the mother. We explain her each and every procedure. So when the child is given, sometimes we give Evago, or we normally use Kshira for Akantapana. And those children who is not accustomed to have Kshira, we may use Ganji, or we may use juice like, sugarcane juice, or lassi we use, or sometimes we give just payasam for them, that itself, and then we induce Vamana. So we tell that you prepare your child. We do tell the child that tomorrow you will be given some medicine. You have to vomit off, and 2-3 times you vomit, and that finishes your treatment, and you can go home. We try to convince the child initially at the OPD level, and the mother is told that 3 times in a day she has to talk to the child regarding this procedure, what is going to happen tomorrow. And the involvement of mother is very, very essential. And in between, our interns will be visiting the room, and they will be telling the child, see, tomorrow you'll be given one juice and it'll be a little bitter, you have to drink. If you drink that, it will be easy. So like that, we keep on telling the child the whole day we take to prepare the child. And next day, more or less, it becomes very easy, and the child will be very cooperative. Sometimes, children with all these counseling are not ready. Once they enter into the room, they get panic and they start refusing heavily. That time we do use the technique of frightening them. And there was a few children, they ran out of the Vamana room, and they had made us to roam all around the hospital. And finally, we used the technique of locking them in the room. And when they get to know that anyway they're not going to leave us, they will definitely cooperate for the procedure. And there were 1 or 2 children, they completely refused, and ultimately they had 1 or 2 Vegas of Virechana. That is also there, but by and large, and normally we use children above the age of 5 years will be given administered Vamana. So they will be, once we counsel, they will be ready to do the things. So we need to be keeping everything ready, not lapsing even a little bit of time. We have to keep on doing one after the one. And we have to be, it is very tiresome for us, because in between we have to keep on talking to the child, and we'll have to say a lot of stories. We have to sing for them, and we have to make them do some actions, imitations. So these kinds of things are there. But by and large, they do cooperate.
Madam, Achasneyapana, your experience regarding use of Achasneyapana at which age?
We have given Snehapana right from the age of 5 to 6 years. So we had planned, there were children with severe atopic manifestations. They had to undergo Shodhana and all for them. So what happens, first 3 days we'll manage with Achasneyapana. Quantity will be less. We may start with 20 ml, 30, 40, then 80 ml, sometimes still 100 ml. It is easy for them to give Achapana. After that, they will refuse. So what we do is, after that 1 or 2 days, we adopt a Virechana Steha. And there have been instances that once we prepared Virechana, the child himself came out, I cannot take this much large quantity, so I will go back to Achapana, like that. So they would take, sir, except, say for example, Panchatikta Gruta, Mahatikta Gruta are the one which are very difficult for children to be given. Vidaradi they take very easily. Indukanta they do take. Patoladi they easily take. And Amrita Prashagruta they easily take. And in children who cannot do all these things, even better than Murchita Grutas, they take these Grutas. whenever they cannot go ahead with all these things, what we do is we ask them to get plain ghee. We do little bit of Virechana with haridra and a pinch of trikatuchurna and all. And we use that plain ghee itself for Utkleshana, bringing about Utkleshana in children.
Vicharana in the sense, are you doing it food articles like payasa, etc. or?
Yes, sir. What we do is we mix it with milk, tila, guda, and make it like a payasa. And sometimes if they are not ready for this, what we do, if we have done that murchana for the plain grota, we prepare something like a kheer, uppitu, or this kesri bath out of these ghees with lot of ghee in that. And we ask the mother to feed that to the child.
Okay, madam. Your experience regarding the Madanaphala lepa to the Nabi as per Kashyapa for Vamana. Have you done this?
We have not done it, sir. Madanaphala lepa and nabi, we have not done it. But of course, Madanaphala churna, a few pinches with honey or mixed with breast milk, we have given and induced Vamana.
What about Grey Yoga, madam?
Grey yoga, no, sir. No clinical experience, sir.
You do this Peyadikrama, Samsajanakrama after Vamana in kids or children's?
Yes, sir. We do it. Sadhya Vamana, we ask them to do only for one day. The next day, we ask them to start with rava uppitu, like without putting anything like vegetables and all, with very little ghee and jeera. We ask them to prepare uppitu and give. Or we ask them to prepare this ganji itself, rice ganji, in a little thicker quantity, thicker consistency, and we'll give. And by the end of second day evening, we start with khichdi. And next day, anna rasam. So very soft rice and rasam. Because anyway, light food has to be given. So we may not be able to make them to have the ganji itself. So we do practice such kind of things.
Madam, how many percent of patients you have observed Pittanta Vamana?
Pittanta Vamana, maybe less than 50%. Sir.
Okay. So any complications during and after the Vamana, madam?
No, sir. Vamana has been a very safe procedure for us. Not even a single case we have come across the complication.
In the sense, I'm asking about Ati Yoga.
Ati Yoga, no. Ati Yoga was not come across, sir. But what had happened, there, I think 2 or 3 children had experienced even after they had around 10 to 12 Vegas of Vamana, but they were quite stable. But even after that, they had 2 or 3 purges. So that was there. That may be because we could not elicit that the complete evacuation through the Vamana. But apart from that, no, sir. No such grave complications with Vamana we have come across.
Another an important aspect in this. How many percentage of patients you have observed Virechana after Vamana? After Vamana means Vamana Vega, the remnant will pass through the lower route in the sense.
Maybe 6 to 7%.
Only 6 to 7, madam, because laxity is more. Laxity of sphincters, as the kids are not drinking faster, rapidly compared to the adults.
Yes.
They will drink late.
Yes.
When it is late means it will go downward and causes Virechana. That's why I'm asking this important question regarding.
Only 6 to 7%, sir, not more than that.
Then it's good. Okay, madam. We'll move on to next question. Your clinical experience regarding the use of different Virechana Aoushadhi in Bala in different conditions.
Virechana Aoushadhi. Yes. Yes, sir. So see what happens. Virechana is again little bit, it causes discomfort for children. So most commonly, 95% conditions we use Trivrat Leha. whether it is for Sadhya Virechana or for after the Snehapana, when we classical Virechana, we mostly use Trivrat Leha. But only thing with the Trivrat Leha is not palatable. Though it is sweet, the children don't like the taste and smell of Trivrat Leha. So what we do is we somehow make something like Gulika and ask them to gulp it. Sometimes we add little more honey to it and give it. Or sometimes we ask them to mix it with Drakshi Rasa and take it. But in any form, most of them, they don't like the taste and smell of Trivrat Leha. But as the effect wise, wonderful. Only thing what we have observed with Trivrat Leha or any kind of Virechana for that matter, especially when we give in school aged children, they are mostly having Krura Koshta. The Krura Koshta is not by Prakriti, they mostly because of their habits, eating habits, and the Vegara, the Pravruti is very much in these children. So what we do is we will have to give little, you may be wondered if I say for a 8 to 10-year-old child, we give around 40 grams or 50 grams of Trivrat Leha sometimes. So with that much of Trivrat Leha, we get around 10, 15 Vegas. There have been children who have even crossed 15 Vegas. But what we do is after 15 Vega, we start asking them to start with a procedure to control the Vegas. So this has been the experience with the Trivrat Leha. Apart from Trivrat Leha, it's very easy to administer Vipatti Karachurna. So by and large, whenever we want a Sadhya Virechana or something like, Nitya Virechana kind of thing, we give Avipatti Karachurna. So children take it nicely because somewhat sweet as compared to Trivrat Leha. Then, especially in developmental delay conditions, when we want to induce Virechana, we use Snigdha Virechana Dravyas like Sukumara Erinda or Gandharvastha Erinda itself. Maybe we'll be administering this in the night time, bedtime, maybe after 1 or 2 hours after giving the food. We ask the mother to advise this. The child might have 1 or 2 soft motions next day morning or maybe in the early morning. So that we have used. And when it comes to conditions like the skin diseases, where sometimes we advise Nitya Virechana, we have used Kalyana Gulam or Manibhadra Gulam. Safely taken by the children without much complications. And regarding the cases like jaundice, we normally use Katuki Churna mixed with Avipatti Karachurna to induce a Virechana for these children. And Kampilaka, we have used Kampilaka. Quite a good experience with Kampilaka also. Maybe 1 to 2 grams only we use in combination with either Avipatti Karachurna or sometimes with Haritaki Churna. Excellent, especially in case of creamy koshta. Very good results with the Kampilaka Churna. So the bouts of Virechana will be little Tikshna when we use Kampilaka, but excellent results with regards to control of the creamy koshta.
Madam, Aragvada is considered as best for pediatrics. Have you have any experience regarding the use of this Aragvada? In which form and how much dose you are giving?
Aragvada, Aragvada, the Kashaya only we use, sometimes in combination with Avipatti Karachurna. We had opportunity to prepare Aragvada Leha and we had used this. This is more comfortable as compared to Trivrat Leha. Has a less abdominal discomfort as compared to Trivrat Leha. But since it is not available in the market, so we are not regularly using the Aragvada Leha.
Any other than the general precautions, which are the special precautions you are going to take to prevent the vomiting of the Virechana Dravya?
Sir, that prior to inducing the Virechana, that avoidance of kapha aharas is very important. So maybe we'll be adding one Pachana and Anulomana Dravya a day prior to inducing Virechana in children. And we may ask mother to give some soups which are little bit of pitta kara in nature, or sometimes we ask them to take pani and all, and good results with that.
You are following the 3-day Vishramakala as per the Shastra,
Yes.
or you are shortening?
Yes, sir. 3-day Vishramakala, except in case where we are doing Sadhya, Sneha and Virechana, 1 day Snehapana and 1 day Vishrama and Virechana we are given. Except in that condition, we are using the classical guidelines only.
Okay, ma'am. What about Snigdha Virechana in this means Eranda Thaila you have not explore means enlightened, madam, regarding your use?
Using Eranda Thaila only, sir. Eranda Thaila in the form of Sukumara Eranda. Or else Gandharvastha Eranda only we are using.
It is not at all. Adults also feel not palatable. It is how you are giving.
Sukumara Eranda they take it, sir. With milk they take it easily.
Or with the, are you adding chocolate for all this Snehana, Vamana and Virechana Dravya?
No,
for some
sir.
cases?
No, sir. Not even a single case we have explored that. We feel that, even the children, when we add those things and make it more or very bad and unwanted smell, they don't take it. Otherwise, if we counsel them, the medicine will be having this smell and taste. Somehow they close their nose and then they just gulp it. So that has been, more easier than making it tedious for them.
Complications, any complications? Notable complications, madam?
Yes, there had been few children who went with a dehydration, and there's children sometimes they had a vomiting. When we induced Virechana, they had both vomiting as well as the Virechana both, and they become a little weak. So sometimes we had to give them antiemetics, and we had to forcefully control the vagus of Virechana, but not to the extent of using any medicines like loperamide and all. But there were some complications, and there was a child who ended up in dehydration, and we had to give him IV fluid also. And sometimes these parents, they are very persistent to get discharged on the day of Virechana. So the child was stable in the hospital, but the moment they got discharged and child walked about 100 steps and the child had a fainting, and he was made to readmitted. So we take the precaution to, we see that the child is discharged on the next day. So this has been, and rather than Virechana, sometimes we do see with these children, during Snehapana, they don't like to take ganji. So they keep on saying that they don't have hunger and all. Sometimes they push till the evening, and after that they are ready to take something like khichdi and all. So these children sometimes presents with vomiting, the chest pain, and features of gastritis. So this thing is there. So we need to be ready for that. So sometimes we do, we are forced to use some of the drugs like Sutashekar and all, but otherwise quite fine with even Virechana.
Okay, madam. Next question, madam. Clinical experience of use of different Basti formulations in musculoskeletal diseases.
Musculoskeletal diseases. Yes. Normally, sir, musculoskeletal diseases, we come across like DMDs, right? And we come across like myopathies, and we do come across like rickets-like condition, not exactly rickets itself, but rickety-like conditions we do come across with the skeletal dysplasias and all. So what we do is, rather than using various only Vasti or only the Shodhana, the external therapies are most important. And some of these children, they'll be extremely weak when we speak of myopathies and all. So mostly we use Matravasti, and in older children we use Tanvasanavasti in a little higher dosage also. And some of the children who can cooperate, they have the good sphincter control and all, in them we normally use Mustadi Rajayapanavasti. So Rajayapanavasti, we use the dose up to 300 to 350 ml in children. So they sustain it very well. They may have a retention capacity up to 10 to 15 minutes. There are children who do even release it quite early, like 5 minutes. Then we may have to reduce the dose even lesser than the expected dose for the child. And in some of the conditions, we have used this Balada Shumuladi Kshiravasti also. And in case of skeletal dysplasias, we have tried to use Tikta Kshiravastis. Children do accept well Tikta Kshiravastis. And Panchaprasrutavasti is again one of the this one. We may not be using the exact Panchaprasruta quantity, but the same combination we reduce as per the age, and that much quantity we will use again in case of skeletal disorders. So we had very good experiences in treating skeletal dysplasias, then the Pert's disease, then the rickets. So we have used these Vastis. And this is about the musculoskeletal disorders. So more by and large, the Matravasti or Anvasanavasti is the mainstay. Only in selected cases we use those who have good Bala. They are able to walk a few steps and they are able to maintain their toilet needs and all. We use this Kshiravastis.
Madam, we were most commonly used Sneha for these conditions, musculoskeletal conditions.
Mahamasha Taila, sir. So we would prefer to use Samisha Mahamasha Taila. And sometimes we do make some combinations, like, use of some Gruta, which containing Mamsurasa and Mahamasha Taila also. And we most commonly we use this only, sir.
Mahakalyanakam?
Mahakalyanaka Gruta. If Agni is good, yes, Mahakalyanaka can be used, sir. And more or less it is Brahmana and Medhya. So we would just like to go with the Balya kind of drugs, like, Ashwagandha Gruta. Rather than Mahakalyanaka Gruta, we use Ashwagandha Gruta in combination with this Mahamasha Taila or Bruhat Chagaladi Gruta with Mahamasha Taila. That is most preferred in case of especially myopathic conditions.
Okay. Share your clinical experience of use of different Panchakarma procedures in pediatric neurological disorders.
Well, again, neurological disorders. And there is one more question, I think, sir. Use of Panchakarma procedures in cerebral palsy.
Yes, you can combine it.
Yes,
yeah.
sir. So
both
almost go hand in hand, sir.
Some other than CP, also some other palsies also you can
yes,
include.
Definitely, but more or less the principles will be the same, sir. So the selection of the medications and the principles would be very same. So what we'll do is, in CP, rather than or in this one neurological conditions, rather than use of Shodhana, the external procedures, especially in children, are of more important. So in neurological conditions, what we do is, of course, Basti is the main the line of treatment. And it depends upon what kind of neurological complaint the child is coming with. Say, for example, sometimes the child comes with extreme hypotonia. So in hypotonia conditions, again, the use of Basti in the initial stage is not at all possible. So initially we treat it like, Rukshana only we go ahead initially. So maybe with Udvartana or Utsadana we go, and followed by Parishekas and Upanaha, that is strengthening type of Upanaha we will use initially. And little bit of when the child is able to maintain the sphincter control and all, then we can go with the Matra Vastis in a very small doses. We may start with 5 ml, 10 ml like that, and then we go on increasing. And in diseases with the Stambha Pradhana, more of Snehana and Balyavastha type of line of chikitsa we use. And in case of the movement disorders, especially presenting with a kampa or like athetosis and ataxia, what we use is we styrya kara chikitsa we try to use. So Ashwagandha and Kapikachu would be used as a, or Bala would be used as a main drugs in such conditions. And in case of Ardita, we can have a very good results in Ardita. So if the child is a little older, we do Shirovasti. So Shirovasti, the children do tolerate well, and we have very good results with that. And Pratimarshanasya will be using. And some of the, the Svedana procedures, Kshiraduma also we have tried using in case of Ardita. And local massages and local Annalepa. Then in Pakshagata again, the same, similar to that of cerebral palsy as we use. So the treatment would be done, sir. And Basti is, of course, in all these conditions, Basti is the only the Shodhana procedures we frequently use if we use Niruhavastis. We have used up to Yogavastis, and there are very few conditions we have done Karmavasti. We had done Karmavasti in a diplegic cerebral palsy, and we had done Karmavasti in case of this one, like a Perth's disease and all. So they had given very good results with us. Otherwise, normally Yogavastis we plan. That's been about neurological. And if I have to speak specifically about cerebral palsy, and it is mostly a child with a cerebral palsy means mostly we take it as Kevalavada condition or Dhatukshayajanya Vata Vikrati. That's been the pathology because it affects the developing brain. So there is a loss of brain matter that leading to Dhatukshaya and Vata Vriddhi and associated complications with Vata. So it usually can present with the deficits like spasticity, either with a weakness and developmental delay and Mamsa Shosha, and the postural defects would be there. And occasionally with involuntary movements and seizure disorders will be there. So in such conditions, mainly the external therapy will help along with like Snehana, Brahmana and Apana Chikitsa. And of course, even use of physiotherapy is very important in these kind of children. For better stimulation, initially, in these children, what we usually start with Rukshana. And we know that normal principle of Vatavyadhi is a Vyathyasa Chikitsa. And even in children, when developing brain is involved, a lot of pathway for the stimulations is lost. So especially the motor pathways. So we try to give lot varied stimulations, maybe in the kind of Ruksha, maybe in the kind of Snigdha, Ushna, Shita. So various type of stimulation we would like to use in such conditions. So Vyathyasa Chikitsa is the best one to manage cerebral palsy. So initially we would start with a Utsadana or Udvartana, and we may have a course of 3 to 5 days. We don't do Atirukshana for these children. according to the child's condition. We plan and followed by Abhyanga. Abhyanga usually we use based upon the child's presentation. If it is presenting with a lot of stamba, spasticity and all, we use drugs like Prasarini Taila or Mahamash Taila or Mashasandava Taila. Sometimes, Dhanvantara Taila. And followed by Pindas Vedas are the most one which we use, especially the Brahmana Pindas Vedas. Kashika Pindas Veda, or sometimes we use a Masha Pindas Veda, or sometimes
Madam, you can unmute yourself.
Am I audible, sir?
Yes, yes, madam.
So we use Bandhana procedure. And since these children are mostly dependent, only a few children would be independent. So mostly Matravasti or Anuvasanavasti is used. Children who are little bit mobile and above the age of 5 years, then we have used Yapanavastis, especially Mustadi Raja Yapanavasti. Or those children associated with the movement disorders, we have used Baladashmuladi Nirohavasti. Then physiotherapy is again a very important component of treatment of cerebral palsy. And Murdhini Taila, since the sthana affected is Uttamanga, Murdhini Taila is one of the important step in the treatment. So most probably we use Dhara because these children head control may be lacking. So they may not have the balance, they may not be able to sit. So the mostly used procedure is either Shiropichu initially in a very small children, or Shirodhara is the one. And when we ask the mother to stimulate at home, we ask them to do about Shiro Abhyanga. Then these children are having this spastic column. So they do present with the constipation. So Sneha Virechana in between the treatment or repeatedly we do use Snigdha Virechana for them. And they are associated with multiple Indriya involvement. The child may be having issues with the vision, issues with the smell, issues with the hearing, issues with the speech. So the local stimulation procedures may be in the form of Pichu, a local Pratisarana, local Abhyanga kind of things. We ask the mother to do it. Sometimes we do it in the hospital level when they are admitted. Then Pratimarsha, and maybe after 2 or 3 course of treatment, we would start with the Pratimarsha for children with the cerebral palsy also. And mostly it is Pratimarsha because they will not follow our commands and Marsha is highly impossible in them. And finally, since the Indriya Dushti is there, possibilities of intellectual deficits are also highly associated with these children, especially with those of quadriplegic cerebral palsy and or dyskinetic cerebral palsy. So what we do is use of Medya Rasayanas. Sometimes we use Medya Grutas for Vasti itself, like Brahmi Gruta and Saraswata Grutas. Our internal medication on discharge also we use Medya Grutas. And Swarna has to be used invariably because for the for better nerve and stimulation. And sometimes we do use when the child is having a good intellectual capacity and it's only the tone issues and the power issues, we do use a Bala and Brahmana science. Hope sir I have answered the neurological as well as cerebral palsy both.
Madam Basti, are you giving yourselves or a therapist is giving the Basti for the?
We have trained our therapists sir how to give Vasti for children. So because we'll have more than 10-15 children for Vasti. So for all children will not be able to stay there. Our therapists do it effectively, sir. Or the PG scholars and the interns are also trained on this. So they are doing it. Only thing, the precautions we have to take while giving Vasti to a CP child. You have to divert the mind of the child. If the child is crying very badly while giving Vasti, so the retention will not be good. So immediately, because of the increased abdominal pressure, the Basti would not be taken up properly, and they release it quite fast. And sometimes when children who are very cranky and they not at all cooperate, we ask the therapist to go to bedside and give Vasti when the child is sleeping. And there have been instances where we could not even practice that. So sometimes we do even train the parents to give Vasti at home, and they are doing it, sir. And as you know that especially in Ushna Kala, we advise them you can give Vasti even in the night time also. Sometimes when the child is sleeping, we do give Vasti.
Okay, madam. And what are all the complications you have observed regarding the Basti use?
Anvasana Vasti, Matra Vasti, straight away no complications, sir, except for poor retention. If the child is not diverted well, and if it is given during crying episodes and all. Uncooperation is again one of the things. Few children, they do not cooperate at all. They will have this perineal spasm, voluntary spasm, and they do not allow you to introduce catheter. This is the reason we do not give directly with using that Vasti cannula. We always attach a catheter for the children to be given Vasti. So they never allow us to do the Vasti. So in such conditions, 1 or 2 days, we'll have to have a nice play with them, and then they may cooperate. And sometimes when it is not at all possible, as I said earlier, we'll ask to give Vasti during sleep. So that has been very well practiced. And apart from this, with regards to Niruha Vasti, the dose calculation is very important. So if normally calculation of Vasti dose is based upon the age. Sometimes, though the age is 6 or 10 years, the child's nutritional status and weight will not be matching to the age. So it has happened in one of the cases. So the child, the Vasti dose was calculated by a person who has not seen the child, and he had put the dose as per the age. So what had happened is the child had a severe diarrhea after giving Vasti, sir. And we had actually, it was a very tough time for us to maintain that child. So after that, normally what we do is we calculate the dose for the age, and normally we reduce 1/4 of the dose required for the age, and then give something like, Ardhamatrika Vasti and all we practice. Or whenever the child's Bala and all is good, definitely as per the age we practice. Apart from this, there was 1 or 2 instances where the retention time was higher. Basti Pratyagamana, normally when we practice Yapana, we will wait for about 1 or 2 hours till the Basti comes out. Otherwise, what we do is we give suppositories, or we give followed by hot water enema or the salt water enema, so it is pushed off. Sometimes abdominal distension was experienced after Vasti. This usually happens. Normally, we would advise them to keep the breakfast and all ready. As soon as the child passes, you have to give the breakfast. Sometimes they do miss it. They think that baby is dirty, so they start giving bath, dressing up the child, and then give the breakfast. So in such conditions, we had come across in the abdominal distensions and all. So normally we use either Parisheka or Avagaha for such kind of this thing, and it's it's been very good to relieve such complications. These are the complications which we have come across.
And Nase yogas for this pediatric neurological conditions, madam.
Shirabala 101 is the most commonly used drug, sir. Otherwise, Dhanvantaram 21 Avarti we are using. If they are not available, we go ahead with the Brahmigruta itself for the neurological disorders. I'm sorry, for Nasya.
Okay, madam. Next, we will move on to discuss your experience regarding the Panchakarma procedures in ADHD cases.
Well, that's a very hot, burning topic, sir. Now, ADHD and autism for that matter. Now, if we speak of ADHD, the cardinal manifestations. Before planning the treatment, we should know the cardinal manifestations and pathology. By and large, ADHD could be because of the variations with the pranavata, or we can say the neurotransmitters level, there is a imbalance. And the child is presenting with the three cardinal features: impulsivity, hyperactivity, and attention deficit. And more or less, they are Vata Pitta Pradhan features. And most of the time, these children do present with some of the abdominal discomfort, and especially triggered with a certain kind of food. And whenever the child is given these food, this hyperactivity gets triggered. So most commonly, the example is gluten hypersensitivity. Whenever the child is fed with the dairy products or chapati kind of thing, the difficulties with the child will be higher. So considering these facts, the first line of treatment is Amapachana. So usually we use Ingvashtika Churna with the food, or Drakshadi Kashaya, or Arvindasava, and sometimes even Vidanga Tanduladi Churna could be utilized. Or sometimes we use Dushi Vishari also. So initial, then once the child's appetite is better, the quality of the stool is better, and then his activities are finer, then we just categorize it, whether it is impulsivity and hyperactivity predominant condition, or it is inattention predominant condition. So if it is impulsivity and hyperactivity is more, it is more or less Vata Pradhana. So the Snehana is the thing which is more important in these children. So we would go ahead with the Snehapana. It depends upon the child's acceptability. If the child is older, ready for Snehapana, we'll start with the Snehapana, or we go ahead with the Shamana Sneha. Then followed by once the child's, we have seen as the Sneha progresses, the child becomes more calmer, hyperactivity comes down. Then we'll give a Mrudu Snigdha Virechana for these children. And Gruta Yogas would be given for the Shamana later, along with the Swarna Kalpas. Or sometimes we even use medicines like Brihatvata Chintamani. And if it is inattention predominant conditions, then Shodhana and Virechana is the most thing which is required. So we go ahead with the Sadhya Virechana for these kind of children, followed by external therapies like, Parisheka, Dhara, Udvartana, Rutsadana, then Shirolepa. This kind of treatments are done more. And Snayika Nasya also we use, maybe in the form of Kshirabala 101 drops. That is Navana Nasya will practice. And Basti. The child, if it's not having any abdominal issues, we'll go ahead with Basti. There have been instances when we had just overlooked the abdominal condition and we had started with the Basti. The child's hyperactivity had gone increased. So nowadays it is a practice. The first we have to correct the Pachana is the first line, then followed by Basti. Normally, Medagrutas are used for Basti in these children. Sometimes we do use when it is purely a hyperactive kind of thing. The Yashtimadu Taila also we have tried for Basti in these children and gives very good results. And Pitahara line of treatment initially. Then finally, Amalaki or Draksha Amalaka Rasayana or Midhyagrutas, Swarnakalpas are the Rasayana medications which we use for ADHD.
Madam, next question. Panchakarma in autism.
Yes. Again, one of the most burning topics and the most experimented areas nowadays, but still most unsuccessful again is autism only. Again, as I said, autism presents with the socio-communication issues. So the child has deficits in social interaction and speech and communication language issues. The child could be very solitary, having solitary play, repeated repertoires, aggressiveness, hyperactivity, lot of digestive issues. Then there will be the child may be very aggressive, and the child is having excretory issues and sensory issues are too much in case of autistic children. And that's how, mostly these children, there will be a lot of variation. One day child will be very aggressive, next day child will be very calm, one day child will sleep nicely, next few days child will be very hyperactive. So varied presentations these children can present. So our pathology has to be kept in mind. And as I said, Pachana is the first line of treatment. Again, Pachana and Rukshana is the one which we initially start with, maybe with Dushvishari, Vilvadi Gulika, Hingovachadi, or sometimes Vidanga Tanduladi. Then the Pradhamananasya. So initially, see, unless until you get a little bit of attention of a child and a little bit of response, you don't know what you are doing. So that is the first line of the management, but we try to get a little bit of attention of the child initially. So mostly we use the external Rukshana therapy in the initial stage, followed by, along with this, Pachana would be definitely there. And once we find that, yes, the child is little bit comfortable, his intake is improved, output is regular, stool's quality is better, the child has little bit eye contact back, he starts responding and listening to commands, then we would start with the other kind of treatment, that is with the Snehana. Then Snehana again, Shirodhara, Shirolepa, and Nasya, especially Snaika Nasya in the later stage. Then Basti is when we use, the Abhenga and all we do. Then Basti, when we speak for these children, again, as I said, this especially autistic children, lot of gut issues will be there. So Basti should be always Pachana Basti in these children. There have been many trials around nowadays. People are trying with many kind of vastis, like vasti, takra vastis, use of mastu, use of the curds. Many things have been under trial as well, but nothing is established clearly. And along with that, the child has a lot of oromotor and swallowing issues, and also oromotor stimulation in the form of asya pratisarana. Then followed by Rasayana, of course. Rasayana involves the Medya Rasayana, more of calming medications for the child. And this child would definitely require repetitive treatment. Maybe they may require 6, 10, 8 rounds of treatment before the child gets a good, appreciable level of change, right? And in between, we may advise them to give some Nitya Virechana or Mrudu Virechana kind of thing. So, but this has to be done, in a Vyathyasa Chikitsa is again has to be continued in case of autism.
Madam, next question.
Yes, sir.
Panchakarma procedures in respiratory illnesses like asthma, tropical eosinophilia, etc.
Yes. When we speak of respiratory conditions, we know very well. This is a very potential area for especially Ayurveda practitioners, especially the pediatricians. So the 40% of children for their OPD visits will be with the respiratory complaints. So recently detected case, respiratory complaints means they can come with either pratishaya, chronic pratishaya, or acute pratishaya. Those candidates who go for this panchakarma would be those of chronic pratishaya, then recurrent kaphajakasa, or recurrent vatajakasa, or children who are coming with tamakashvasa. So these are the candidates they normally go in for the panchakarma procedures in the clinical setup. So what we'll do usually in kaphajakasa, we have tried this one, Sadhyavamana. Sadhyavamana gives wonderful results. Following Sadhyavamana, we put the child on Rasayana for 3 months. So Sadhyavamana usually we used to do with Akanta Kshirapana, Yashtifanta, Vachapipali Yoga. So induced Vamana, the child would be admitted for 1 day. Essentially, you have to screen any child who is going for Vamana, you have to screen for 2 things, the cardiac function as well as the chest X-ray. So make sure that the child is not having any such complication. There could be some congenital issues. Again, the child would be getting recurrent cough and cold. If it is not screened and we are inducing Vamana, that may complicate. So that is a very essential procedure. After that, Sadhyavamana is done, and 1 day Vishramakala, the child would be started with a Rasayana. Rasayana either in the form, because we know that Pratilomam Medavayu. So we start with the Dipana Pachana Anulomana kind of Rasayana. So most explored medication in this condition is Chitraka Haritiki Rasayana or Agastha Haritiki Rasayana, gives wonderful results. Children are also okay with this, and after that, we may switch over for either Chavanaprasha or Amalika Rasayana, and then we end the treatment for these kind of children. Those children who are coming with chronic pratishaya or allergic pratishaya, we do a course of Nasya for them. Children above the age of 7 or 8 years, we start with Marshanasya for a period of 7 days and followed by Rasayana. Otherwise, we ask the mother to do Pratimarshanasya at home and we'll start with the Rasayana. Next comes is the case of asthma. So as I mentioned earlier, acute treatment with asthma is sometimes, very not comfortable because the child may suddenly end up in a cessation of breathing, that is apnea, or sometimes aspirate, or sometimes they develop chest tightness. So what we do is initially Shamana medications we give and then induce Vamana after taking thorough confidence of the child. And after Vamana, we'll start with the medications. If it is Kapha Pradhana, recent onset, definitely with Vamana they respond well. If it is a chronic one, recurrent one, tendency of atopy is there, tendency of eosinophilia is there, they are not settling with the Vamana. So we have to have Snehapana and Virechana for this kind of children. And our experience is that after Snehapana and Virechana, at least for next 2 years, maybe in between, initially, maybe even after Virechana and Vamana, in the next month, they might have 1 or 2 episodes, but they settle very well. And we had experienced a few children, even though their titers did not go down, but they were comfortable for at least the next 2 years without any clinical manifestations of the conditions. So at least 3 to 4 months of this Rasayana is required for these children. And if possible, in between, we may have to give a Sadhya Virechana at home or this one. They respond good for this. In case of tropical eosinophilia, this question was there. Tropical eosinophilia, we should always adopt a Krimi Chikitsa. Without Krimi Chikitsa, the recurrence will not be very good. So, the results will not be very good. So usually, in such condition, if possible, like use of classical medicines like Vidangadi Gruta or Trishunadhigrita will be ideal. If not, we normally use Pipaladigrita or Indukantagruta itself. And following Virechana, we may add any Vidanga yogas or Krimikutara rasa or something like that along with the rasayana. So then they respond good. And to be very frank, in clinical practice, classical eosinophilia we don't come across. The trophical eosinophilia we don't come across. Children with eosinophilia, yes, definitely we do come across. And they respond good with the Krimihara line of tickets.
Okay, madam. Then next question, madam. Panchakarma in pediatric Amavata or juvenile rheumatoid arthritis.
Sir, am I exceeding your time, sir?
No, you can quickly wrap up with your experiences only.
Okay, sir. Amavata, I mean, very rarely we get, sir, pediatric Amavata for, especially in our setup. So even if we get the rheumatoid kind of presentations with the joint issues. So these children will respond good with Pachana Chikitsa followed by Snehapana and Virechana and Rasayana. Sometimes these persons, they would require Vasti in the follow-up treatment. We have done Rukshavastis, again Rukshavasti in the form of using this one, Bratsandavadi Thaila itself. And for Abhing and all also, for them either we use Bratsandavadi or Chikadi, followed by Svedas like, either Parisheka Sveda Dhanamla Dara or Dashmula Dhanamla Sekha or Patrapinda Sveda we do use, then followed by Vastis. Only I think 1 or 2 cases we had used Vaitarana Vastis. Otherwise, Anavasana Vasti with the Bratsandavadi Thaila only we are frequently using.
Okay.
And this, of course, needs to be followed up with thorough Urjaskara and Rasayana Chikitsa, sir, because maybe a disease modifying agent is required for them. So use of Swarnakalpas is invariable in case of Amavata. Gugulakalpas, then Swarnakalpas. They do respond well. The results are not so encouraging in idiopathic juvenile rheumatic conditions because the recurrence is very high, and we may start feeling this child is responding, but they come out with recurred swelling and joint pains. So not very well with the idiopathic conditions, but rheumatoid kind of presentations, they do respond well with the Ayurveda treatment. Maybe we need to explore more because as I said, the number of children we have explored is very less in this particular area.
Okay, madam. Okay. And next question, which is the most preferred and highly effective methods of Panchakarma for enhancing immunity?
Rather than Panchakarma, sir, I would go with Dinacharya, Rutucharya and Pachana. So children don't require Panchakarma.
That is there, madam. But Panchakarma in most means low immune children's.
Yes, low immunity children means usually they present with this allergic kind of manifestations. So invariably, Virechana is the best thing to enhance immunity in these children, sir.
So in the Kantagurtam, if you want to give Svedana or Basti, how your preferred way of administration of Sneha for enhancing the immunity?
Indukantagruta we give as both for Shodhananga Sneha we use and as well as the Shamana Sneha. Later as Rasayana also we have used Indukantagruta, maybe enhanced with some more Pachana Dravyas, maybe mixed with the Trikatu or something like that. Then for Vasti the same, sir. Usually Matra Vasti we give But for enhancing immunity, we don't explore Vasti as such, the Pachana as well as Shamana Sneha.
Okay.
That is
Madam.
and
Last question, madam.
mostly practiced for enhancing immunity in children is of course Varna Prashna, sir.
Yes, madam. Yes. Last question is your clinical experience regarding the use of Panchakarma procedures in Shayamutra.
Well, Shayamutra again. I think Panchakarma is not very much appreciated for Shayamutra, sir, unless until, Shayamutra, we have two kinds. One is primary and the secondary. In the primary conditions, yes, sometimes we require Panchakarma, that too not the Panchakarma as such. The Purva Karmas are utilized more. Otherwise, for bedwetting, toilet training, counseling, bladder strengthening exercises, then modification, reinforcement, these are the things which help them very well. That could be done in the OPD level itself. Then in case of primary neurisis, when the child is presenting with bedwetting secondary to like spina bifida or any the neural tube defects or kind of post-surgical in such conditions, Kati Pichu and Matravasti, initially the child will not have sphincter control. Even they might have lost the control and the anal sphincter also. So even Vasti, they won't retain for longer time. So initially we start with the lower, the perineal strengthening exercises and all. Then start with Kati Pichu, Kati Vasti, or local Pichu in the Basti area. So this we initially start. And once the child starts sensing, they start telling, yes, now I can know the urge of urination and all. Once they start giving us this feedback, we start with the Matravasti. Matravasti again in a very low dose. We may start with 10 ml. And because the retention would not be there. But in some of the cases where we have treated this primary neurisis with this kind of treatment, we have seen very good results. To the extent that the child have stopped bedwetting, that continuous incontinence was reduced, and the child had the urge sensation, and they were able to go and void themselves, and their walking style was better, the retention was better, their urge of defecation they could identify. So this quite a lot of changes we have seen with this. But otherwise, I think Panchakarma is not ideal because they don't have the control over this sphincters. And orally, of course, something like Pupilu preparations and Metarasayana should add to the enhanced effect.
Okay, madam. One question from the participant.
Yes, sir.
Can you try something in developmental delay in Down syndrome kid? Shaman Chiksa make improvements. Age of kid is 1 year, 8 months.
Yes. Though the pathology is trisomy 21, the presentation is developmental delay, which is as good like the neurological condition. The neurological things may not be involved, but the stimulations we can use in the same line. So Abhyanga gives a very good, strengthening for these children might have hypotonia, this Down syndrome children. So Abhyanga and Utsadhana would definitely help, sir.
Okay, madam. To the participants, do you have any open questions you can ask directly to the madam? You can unmute yourself and ask the questions.
Hello, ma'am.
Hello.
Ma'am, good evening.
Good evening.
Ma'am, I have just started Panchakam procedures in my OPD. I have got a
Please restrict to your questions only. Don't talk general.
Okay, sir. Okay. So I have got a kid of age almost 2 years, and he is suffering. He has been diagnosed as Down syndrome. So
it is
I'm
already answered. Your question is answered just now.
Okay, sir. Okay.
Next, any other questions from participants?
Good evening, madam.
Good
Lead
evening.
poisoning in children.
Okay. Lead poisoning. If the child is not presenting with any neurological issues, even if it is presenting, you start with the Dushivisha Hara line of treatment, ma'am. Give some Virechana Aoushadhi and Dushivisha Hara line of treatment. And you can use the Bhrungaraja Sava, Bhrungaraja Swarasa kind of medications to flush out the accumulated lead. And if it is presenting with a neurological deficits already, so Vata Vyadhi line of treatment has to be done.
Next question.
Thank you, madam.
Any questions from participants?
Hello.
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 Hello, Dr. Rahul. You can go ahead.
No more questions from the participants? So I'm going to close the question and answer session. Yeah. Now it's the time for vote of thanks. I'm expressing my gratitude and cordial thanks to Dr. Professor Reena Kulkarni Madam for enlightening us regarding the various Panchakarma procedures and the condition where to use, how to use, and all those things in various conditions of pediatric practices. Practically, she has very elaborately described the disease conditions as well as the how to use Panchakarma procedures and what is the extent of its use and its limitations also. She has enlightened elaborately and also in a beautiful manner, and how to convince both the kid and as well as the parents regarding the Panchakarma procedures and the medications used, different medications for different Panchakarma procedures. She has told in depthly with the classical reference also and line of treatment precisely with different presentations and different stage also she has explained today. And we are very much thankful to Professor Reena Kulkarni Madam for sharing her valuable opinion, experiences, and also treatment strategies. And also she has given almost 2-hour talk today. That's why we are very much thankful to Professor Reena Madam. And I'm also thankful to Dr. Samir Girde for introducing the today's speaker, Madam. And thanks to my students for the prayer also. And thanks to all the participants for participating and also asking questions. Thank you, Madam. Once again.
Thank you so much, sir. And it's my privilege. And actually, I'm blessed to be associated with you. Thank you so much. And I hope that I could live up to your expectations. And if given opportunity, again, I would like to improve. And this one, sir.
More than expectation, you have fulfilled, Madam, today.
Yes.
You have
Thank
fulfilled
you.
more than our expectations. Nicely.
Thank you, sir.
Madam.
Thank you so much.
You, Madam. Today, Children's Day.
Yes, sir.
My kid came at the end.
Oh, that's great, sir.
She knows that now it is concluding. That's why she came.
Yes. Hi. Hi, Putta. Happy Children's Day.
Thank you.
Okay, sir. Thank you so much. Thank you, everyone.